How to perform a self-examination for mouth cancer? Let's ask Dr. Satish C.
November is Mouth Cancer Awareness Month. I get a lot of patients contacting me because they're anxious, they're scared that they have got mouth cancer. So the usual symptoms is they have taken tobacco or have smoked for a short duration of time or a long duration of time, and of recent onset they have some redness or soreness and they're really anxious about it. So the first step is to do a self-examination. So stand in front of a mirror, have a good lighting, open the mouth and examine the inner side of the cheek. This you can first do under visualization with a mirror, and then you can use a finger and feel along the lining of the cheek on both the sides. If anything abnormal is there, like you feel anything hardness, anything thickness, you feel when you see in the mirror some abnormal patches, red patches, white patches, or the mucus has got some ulcer in it, then it is a cause for concern. Not just the cheek, even the tongue, the upper part of the tongue which we usually see, and with the tongue elevated, the lower part of the tongue called as the floor of the mouth, the undersurface of the tongue, the palate, we need to examine all of this. Also, when we open our mouth and say ah, we can see the tonsils and we can see the back of the mouth as well. So it is important to take time and see everything clearly, and if there is any doubt, go and meet your oncologist, dentist, ENT, whoever is there, and get yourself checked up for anything which is unusual. And if it is not resolving in a week or two, then you need to take it seriously and take a biopsy and meet the oncologist. Thank you.